the insurance companies are in the middle. They'll talk to the hospitals and the doctors, and they'll, tell them what they can do, what they can't do, pre-approved procedures, and control them. And then they turn around and they talk to the consumer. Here's the plans you can choose from, and you decide what you want, and we'll take care of the rest of it. The consumer never gets to talk to the provider.
Hello, everyone, and welcome to the Healthy Savings Podcast. We're a new podcast. This is our second episode, and we're very excited to have Barry Murphy join us today. Barry is the founder and president of Prospective Benefits Consulting and has been in the healthcare and health insurance industries for multiple decades and has amazing stories to tell us. So, Barry, we're very excited to have you here.
Well, I'm glad to join you and look forward to having a healthy conversation.
So, the reason we started this podcast was because I think it's pretty well known that healthcare in our country isn't quite health, isn't quite care. There's a lot of issues for patients, a lot of issues for employers. And we want to go solve those issues. I'm the founder of a company called Milu Health that's taking one stab at doing that. There's many others who are doing amazing things. But before we can really solve it, we have to understand how we got here, how it all actually works, and what the different pieces of the puzzle are. And so those are some of the issues that we're trying to tackle here. I'd love to kick off just with an intro to you. How did you get here? How did you start your career overall? How did you start or evolve your career into this space? And then we can take it from there.
I went to Georgia Tech, which was kind of unusual for anybody to get into the insurance business, because the insurance business is at its very core a prospecting and relationship business. And when I entered the insurance business with Northwestern Mutual in 1972, I was neither of those. And but the education I got at Georgia Tech gave me a curious mind and taught me to look at things from all perspectives, and which is why I called my company Prospective Benefits. And I found that I needed to be more astute financially if I was going to prosper and succeed in that business. So,
how did you get to Northwestern Mutual? Like, did you expect to go do that out of college? Was it a chance occurrence?
No, there were two overriding influences. First of all, it was 1972. The economy wasn't terribly robust, and out of college, it was either go to work for a bank, which was hiring at the time. All the banks were, or I thought, hey, what the heck, I'll give this a try. If it works out, great. If it doesn't, I can always get a job. But at least I would be my own boss. And I can tell you that I quit multiple times in the first 3 or 4 years because it wasn't easy to get established. But I kept telling myself, if I go to work for someone else, they're going to expect me to do this, and that. Why wouldn't I just do that for myself?
What kept you going when you didn't think you were going to be successful?
The fear of having to answer to someone else above me that may or may not be more astute than I was. Frankly, it was a drive to, everybody said, don't go in the insurance business. There's no security there. And it occurred to me that if I was my own boss, I would be secure forever. But at any time working for someone else, your security is reliant on them wanting to keep you around.
At that point in time, you weren't working for yourself. You were working for someone else?
No, ever since I got out of college, I really have never, I've had partners, but I've never had a boss per se. And that allowed me to do it my way. Right or wrong, sometimes it works, sometimes it doesn't.
Got it. Well, let's jump into healthcare. How did you initially get involved in the healthcare field, and what did it look like when you first got involved?
It really wasn't my intention to move in that direction. I wanted to work with business owners on their life insurance needs for key man insurance, buy sell agreements, and things like that. But very early on, the prospective clients would tell me, "Yeah, yeah, yeah, I like all that, but what are you going to do about this health insurance?" And I literally joined the health insurance business intending to swat that out of the way so I could get to what I wanted to talk about. But then as time went on, I found it was a much better revenue model for me than continuing to sell life insurance. When I came in the insurance business, there were 37 insurance companies, all competing with each other, and it was pretty much the good old boy network. If you knew someone from church or the synagogue or the golf course, that's how you got in. And again, I had none of that. So I started adding value added services like doing enrollment education meetings, which are common today, developing employee booklets, actually helping employees when they had a claim problem interfacing between them and the insurance company. And believe it or not, no one was doing that back then. Back then, you wrote a policy, and a year later, you called them up and said it's time to renew. That was it. And so I was at the vanguard of starting to sell services. Hey, if you want the education for your employees, you got to let me handle the benefits.
And at that point, selling health insurance into employers was relatively new, right?
It certainly was for me. Actually, if you look at the genesis of employer based health insurance, and I might say it should have never been employer based in the first place, my opinion. But in the 1940s, during the war, there was a shortage of workers and there was a wage freeze. So the government allowed employers a tax deduction if they would offer health insurance. And employers started adding health insurance as a means of compensation to avoid the wage freeze. And it took hold. But it's crazy that an employer gets a deduction for providing health insurance for their employees, but individuals don't get any tax breaks for providing for themselves. And that sort of was the start of how we got into this mess.
It's interesting. I've heard a little bit about the concept of ICRAs, and are more individuals going to move to just getting a stipend from their employer and buying it on the market? And there's arguments for and there's arguments against, and folks say you're going to get a worse plan, but it shouldn't come from your employer. But the tax break thing is crazy, right? Because that drove so much.
Right. The ICRA, came about, oh gosh, what, 5 years ago, 4 years ago? It took us from 1940s to to the 2000s to create a situation where you could develop a tax incentive for individual coverage. But there are no good health plans. There are, one's not better than another. As long as there's an insurance company involved, it's going to be expensive and it's going to be complicated more so than it needs to be.
We're in 1972. You enter the business for the first time. Health insurance then was quite different than it is now. Is that fair to say?
Absolutely. If you remember the definition of insurance out of the dictionary is the protecting against the unexpected, infrequent, financially catastrophic event. Another way of looking at it is pooling risks, where you have the many make a small contribution into a fund that pays for the losses of the relatively few. And it was never intended to pay for health care. The first health plan I ever sold was a $200 deductible, 80% until you had 1,000 out of pocket, and then 100% thereafter. No copays, no drug card. It was insurance to protect against that unforeseen event. The first plan I ever wrote was $18.67 to cover an employee and $45 to cover a family. But at the same time, you could have a private room at Piedmont Hospital for $95 a night. Putting that in perspective, though, you had a $1,200 maximum out of pocket, my income that year was $7,500, which was a pretty good starting salary out of college back in 1972. So my assumption of risk was 20% of my income.
How did it evolve into what it is today, to go from, what's typically thought of as insurance, right? If my car gets wrecked, they'll pay for the wreck, but they're not paying for my flat tire, to, health insurance covers my copay and or I have a copay, but, using my card every time I go to the doctor. Like, what happened in the industry?
Well, again, just as a point of reference, when I started, there were two kinds of health insurance. There was insurance for hospitals, and then there was separately insurance for physician services. And you could buy one without the other. The Blue Cross and the Blue Shield were the combination of those two concepts. But it was not unusual for me to sell Blue Cross for hospital and Guardian for doctors. You had two different insurance companies involved. But with the genesis of the HMOs, which offered economic sweeteners for lack of freedom of choice, when copays came into play, and then relatively early in the process, prescription drug cards came up where you could have a copay for your prescriptions. I advised all of my clients, don't do it. Just don't start down that road, because it's like $1.80 a month to cover prescriptions under a copay. And now the cost of prescription care as part of the insurance premium is much greater than it was for health insurance when I was selling it in the 80s.
That's wild to me. You shared a stat as we were kind of getting ready for this podcast around the percent of the total plan that came from drugs today versus before. That blew my mind. I had no idea that, today it's 25% and it was a fraction of that in the past.
Right. Well, we could spend 3 different podcasts talking about the pharmaceutical industry. Those of us in the United States pay 3 times for a pill what other people in the other country pay. We're subsidizing that. But more importantly, pharmaceutical benefit management companies came about, PBMs, that would carve out and separately manage the prescription process. And they started the process of what is come to be known as spread pricing. And that means they buy low and sell high, selling high to the employer health plan, and they keep the profit. And it has gotten out of hand, so much so that the 3 or 4 of the PBMs are in the top 25 companies in this country in terms of the Fortune 500. And now it's getting to where the pharmacy companies are purchasing insurance companies. Aetna is owned by what used to be their PBM, and it's a sin what's going on with pharmacy pricing and what it costs for pharmaceuticals.
So walk us through how things have changed since you've been in the industry, and what's changing now.
Well, I think the big transition came about. Most people aren't aware. It was 1996 before Atlanta, Georgia, ever saw an HMO. But that's when we started asking insurance companies to pay for routine health care in addition to the unexpected event. And the insurance companies, they make $1.30 for every dollar in claims they pay. They readily, one of the biggest emphases is the insurance company realize, hey, we can make a ton of money spreading on the insurance, health insurance business. So that was the big change. And then the HMOs were all the rage. This was going to save the industry, but they didn't expect the pushback from individuals who said, I want to go wherever I want, whenever I want. And of course, the HMOs tried to say, you couldn't see a specialist without a referral. So that gave rise to PPOs, preferred provider organizations, where you got better benefits if you went in network than if you didn't go out of network. So you maintain the freedom, but unfortunately, it created upward price inflation on the cost of insurance. And we're stuck where the insurance companies are in the middle. They'll talk to the hospitals and the doctors, and they'll, tell them what they can do, what they can't do, pre-approved procedures, and control them. And then they turn around and they talk to the consumer. Here's the plans you can choose from, and you decide what you want, and we'll take care of the rest of it. The consumer never gets to talk to the provider. And that's what I think. I think your first guest on this podcast was Carl Schuessler.
He sure was.
Carl and I go way back. We were both with Northwestern Mutual. I'm certainly older than he is and less enthusiastic. We started looking at this and asking ourselves, who do we work for? We present ourselves as working for the employer, and yet we're paid by the insurance company. Commissions are a motivating factor for anybody who is, quote, selling, unquote, insurance. I used to, say, I wanted to tell my clients, I've got good news and bad news. The bad news is your rates are going up 18%. The good news is I got a raise. And it took us a while, but we started to figure out that we really weren't working for the employer, and that, for at least he and I, and it is now spread through our organization, Mitigate Partners, that there's a conflict of interest if you don't work for the employer. So we don't take commissions anymore. We charge a fee. The employer pays us, and that frees us up to be completely reliant and responsive to our client. I spent from 2010 to 2019 in Southeast Georgia, using some of the ideas Carl and I had developed. I started an approach called a community health plan, and approached a rural hospital who was kind of struggling. It took them on as a client, saved them a bunch of money using some financial techniques we can talk about in a little bit, but then said, how would you like to partner up in a new concept of insurance? And I was able to get a contract from them where anybody that had one of my health plans would get their services at 140% of Medicare. To put that in perspective, hospitals use something called a charge master, and it is a fake retail cost. And then the insurance companies come in and said, hey, we've saved the day. We're getting you 50% off of what the hospital wants to charge you. The problem is 50% off of what the hospital wanted to charge was 300 to 500% of Medicare. So I was shocked when a hospital said, we can make it at 140% of Medicare and do quite well. And so how is it me in Southeast Georgia buying medical services at that price when through the insurance company it's double that?
What's really interesting there, I didn't realize that it started with the hospital, that they were your first client and that you had that relationship with them and could have the honest conversation of, listen, what if we cut out the middleman and connected you directly to, an employer in the area who you'd serve at a fair and reasonable price that would take care of both of you.
Right. And everybody wins. And we expanded that. Obviously, a rural hospital doesn't have all of the capabilities that sometimes you might need in the event of a severe event. So I went to another hospital, which was bigger, and had a conversation with them and got a deal with them at 165% of Medicare, which again was far and away less than they were charging, quote unquote, the insurance companies. So, and then the doctors, they're the victim as much as the populace is. All they want to do is practice medicine, and they've been forced to become businessmen. And, the typical doctor gets paid on a fee for service, which means the more services, the more they make, which means you got to spend less and less time with a patient. And for primary care physicians who can do 85% of everything you need in terms of medicine, they can't afford to do it because of this model they're under. So they refer out 25% of what they could do to specialists, which are more expensive. What we found is the doctors, if you give them 120% of Medicare, I asked my doctor, I said, if I wanted to just come in direct and give you 120% of Medicare, how would you feel about that? He said, I would be delirious about it. That would be wonderful. And then the CEO of the hospital went to the county and the city with us and said, look, I want to partner. So we created a conversation, neighbors talking to neighbors without the interference of an insurance company saying, you can't do this and you can't do that. We got involved in what if kind of thinking.
One question I had for you is, how did you find initial employers to buy into this? I mean, it's kind of a change from the status quo they're used to, which is, you buy a standard health plan and off you go. What were those conversations like?
Well, they were interesting to say the least, because we were suggesting against this giant behemoth industry that had complete control over everything, that there was a brighter and better way. We were faced with a lot of disbelief. And Carl and I were searching for courageous employers who had had enough and were willing to try a new way. And that new way was, at the time, at the beginning, was based on our sense, our experience in the industry, and our belief that it would work. But it was an act of faith. The first employer to embark on this was the Gasparilla Inn down in Florida, and it was Carl's client. And they'd had enough, and they said, what the heck, let's try it. Well, now we've got 7 or 8 years of experience and multiple examples of how this approach operates more efficiently and cost effectively, giving employees better health insurance for lower plan costs. I started looking at databases and Medicare information. And as an example, in Jacksonville, Florida, if you go to one hospital, a knee replacement is $122,000. If you go to another hospital, it's $68,000. But if you go to the Mayo Clinic, it's $22,000.
Which is crazy, right?
All 3 of those hospitals are in network with most of the major carriers. And yet the employee, the member, has the same maximum out of pocket, which at the time was about $5,000, regardless of where they went. So decisions were being made based on, well, my doctor wants to do it here, or geographic convenience. And the insurance company would pay those claims all day long without discrimination with the employer's money. And if you don't give employees an incentive to make better decisions, generally speaking, they're going to follow the herd. So why wouldn't you? Heck, you could waive the entire out-of-pocket cost at the Mayo Clinic and save money from people going to some of the other hospitals in the same city.
How did you get employees on board? Because, this is a change and it's scary not having the status quo, and it's healthcare. How did you guys go down that path?
Well, when you lower or eliminate copays, and this is important, in order for healthcare to work more effectively, you have to minimize the barriers, the financial barriers to care. All too many times, I've come across an employee who needed a surgery but didn't do it because they couldn't afford their share of the cost. And then that leads to higher and more expensive care for that individual later, because they're not taking care of their basic needs. So we design these programs where if you follow our guidance, you get your care close to free, or certainly much less expensive. You still have the freedom to go where you want to go, but if you go to a more expensive facility, you're going to pay more. Not more than you used to. You'll pay what you used to, but if you follow our lead, we'll reduce dramatically your cost for care.
One of the things you mentioned before was, in your career, you've had a few of these moments where you kind of saw where the puck was headed and you pivoted towards that. I come from the tech startup world, and all we talk about are pivots, and you learn something and you pivot towards that. If you were talking to someone who's starting or in the middle of their career now in this space, what direction would you urge them to pivot? Where do you think this world is headed?
Well, that's a twofold question. Where the world is headed is one thing, and what I would advise people to do would be to not go where the world where the momentum is taking the industry. And I would do just that. I would say, look, I'm going to spend 100% of my time doing these, for lack of a better phrase, mitigate partner concepts with direct contracting and building a platform. Hell, Carl and I built the platform. They don't need to build anymore. They can just plug in. And being the pioneers, we took a lot of arrows, but we can translate this platform to any broker and any employer that has the courage. And again, it takes less courage now because we can show you all of these successes. But I would tell advisors that if you believe in it, that's all you do. You don't do that other stuff anymore. And that means you're going to have to walk past some opportunities with what I would lovingly call myopic employers who are willing to put up with what the traditional brokerage community is offering. But again, that takes courage.
One of the things that seems the scariest to me is an employee not having a Blue Cross or United or a Cigna card, right? Like if you've got someone who's having a baby, like, or has cancer or heart disease, it can be scary. Have you found ways around that? Or, from what I understand, in some or many of your plans, they do have access to a broader network. It's just decision making that they have to make around that. How do you think and talk to folks about that?
Well, our plans are insured. The first thing is it is not a fully naked, if you will, proposition. We do have insurance in place. What for? To protect against the infrequent, unexpected, financially catastrophic claim. But below that level, we can do anything we want. We can make it free. We can add co-pays. We can waive deductibles. Getting back a little bit to the pharmacy situation, and I mentioned to you that we pay 3 times for a pill here in the country that others do. We have a program that uses international sourcing for pharmaceuticals. Humira, which is a pretty popular drug, if you purchase that under a Buca health plan, the health plan is paying about $5,200 a month for that drug. And by the way, these drugs don't cure anyone. They treat the symptoms, which means you can be on it forever, which is, a shame. But we can get that same Humira, same thing, right out of the same factory for about $1,900 internationally. So we tell people, hey, you can get your Humira anywhere you want. If you get it domestically through, the U.S. PBMs, your copay is $200 a month. If you'll get it internationally, it's free. So, and if you do the math on that, the health plan is saving a ton of money while providing much better coverage for their employees.
And the employee is saving a ton of money. I mean, even on health plans today that cover crazy amounts of cost on behalf of employees, Humira is still insanely expensive. So that's unbelievable. One thing that came to mind as you were talking, there's that famous Apple computer commercial about here's to the rebels, the crazy ones, and I just saw a clip of it. I'm a big Michigan football fan, and some other fans stitched together a. Thank you, but we just lost our coach. But someone made a little video of Coach Harbaugh against that commercial with the music and the words, but a thing stuck out to me that when there are new ideas, there are arrows that come at you, and you are called the crazy ones, and you probably want to quit a few times. So my question to you is, you must have been called crazy 10 times over as you started this, and you and Carl started this and grew it. How did you keep going through that? And was there any point in time when you were like, I don't know if this thing's going to make it?
Well, we certainly knew enough about the traditional insurance markets to know that that wasn't working. And that gave us some strength to try and find a better way. And again, as I mentioned, we were moving forward in faith well before we had any employers that had faith enough to take a stab at this, if you will. But it's really quite a story that two guys in Georgia could find a better way than Aetna or Cigna. And it's not that the insurance companies don't know about these methods and technologies, but if they implement them, they might lose money. And they're amenable to their stockholders, not to their customers. So, and again, I think it all kind of came together more for me than perhaps for Carl, because Carl's, I think, he's 18 years younger than I am, so he was earlier in his career. But I had enough financial success to say, I'm not doing that anymore. I'm going to do this. It made really good sense to me based on everything I've seen inside and outside of the traditional health insurance world. But I think if I'd have been 28 years old, I could not have afforded to take these steps. So for me, it was the time was right, the experience was right, the opportunity was right, and I had the financial freedom to follow my dream, if you will.
I think two guys in Georgia would be a great tagline for a podcast, a book, a poster. Well, Barry, thank you. This has been really awesome. We've loved having you on, and I'm excited to continue the conversation. And I'm excited to see where everything continues to evolve. But B, I think there's a lot more for us to learn from you on future episodes if you're interested.
Well, of course, at this stage in my life, the only reason I'm still around working is because of the excitement and the ability to prove that our dreams were, in fact, capable of taking form.
Thanks for listening to Healthy Savings by Milu Health. If you would like more information about any of the topics you have heard today, we would love for you to get in contact with us. Find us on the web at miluhealth.com.